Hey gang, this is Andy over at the Healthy Dog Network. We're here obviously with our good friend Stephen Dunbar with the Yorba Regional Animal Hospital and Julie and her dog Ari. I'm going to put up a little picture of the x-rays that I saw with Ari, and the reason that I contacted Steve to kind of get some more feedback on what I saw and my amazement. And as you can see on that one side that I'm showing you, to me, it doesn't look like that ball is sitting in anything. It looks like to me, it looks like it's just kind of floating there. But I'm obviously not a veterinarian and don't know enough to know exactly what's going on with this dog. So I thought I'd come to Steve and see and get his opinion first on this X-ray, because I know there's many of you that have dogs that have hip issues and that kind of stuff, and may be interested in hearing what Steve's thoughts are on what we see in the x-rays, when surgery should be considered, and all the other things, pain medicines and that kind of stuff. So Steve, how are you?
Good, very good.
Very good. So when I looked at that x-ray, to me, it just looks like that ball is kind of just sitting there on top of bone. And this dog runs and walks, at least from my appearance, fairly well. What are your thoughts when you see something like that?
Well, looking at Ari's x-rays, he was born without really much of a socket. So normally the socket in the pelvis is a cup and the head of the femur is a ball, and it should fit tightly in there. Ari's hip is more like an open, there's not really much of a cup, and so there's not much to hold the head of the femur there. So as Ari walks, his femur's bouncing up and down inside and outside of the joint. And so that the soft tissue that holds those bones together now are constantly stretched, and then over time, that chronic inflammation causes bone to calcify those soft tissues and then makes that joint much more rigid and not flexible like it was to begin with. And that is unfortunately a birth defect or just a lack of formation of a cup. On the other side, the cup's much deeper, but it's just not sitting quite as well as it should. But I believe it was the right side was the one that was missing the cup. It's just not very deep at all.
So is Ari a super dog that gives him the ability to be able to continue to run and do the things he does?
Yes, I'm very impressed with the way Ari's walking. We watched him walk earlier, and he's walking very good and really not showing much of a limp. And if I looked at the x-rays and hadn't seen his walk, I would think he would be in a lot of pain and having a lot of difficulty moving.
So I know Julie has a bunch of questions about what she should do with her dog at this point, but when somebody first sees or gets the diagnosis their dog has a hip problem, how soon should they consider surgery? Is like the problem that we see with Ari is not fixing it right away, causing more damage to the dog, or what?
Well, the typical preventive surgery, if you can find dogs like Ari at an early age before arthritis develops, which is generally going to be less than 2 years of age, so somewhere in that 6 month to a year and a half window, they're able to cut the pelvis and cut the pelvis in a few locations. And with a flat joint like that, by rotating that flat joint, they can rotate it over so it creates a ledge. So now the femur has something to sit on and can improve the joint surfaces and rubbing so it will now bear weight. But once arthritis has started to set in and you see bony changes, that surgery is not going to be as effective. So you kind of miss that window at a certain period of time.
So by doing that, you could essentially avoid a complete hip replacement.
Yes. It's one alternative. A hip replacement certainly is replacing the whole joint and the femur, the top of the femur, where this is kind of more trying to improve the apposition of the head of the femur with the pelvis, and much less money, much less surgery, and also much less complications versus a total hip.
So Julie, what are some of the things that you've been told in the past, not to name any names or anything, just what are some of the things that maybe confused you about when to get surgery and when not to have surgery?
Well, for starters, I've never heard that one before. Is that something that he's already passed being?
At this point, yes.
Okay.
Since he's already showing arthritis at this point, that movement of the head of the femur over there wouldn't benefit him.
Okay. I have talked to another surgeon about a year ago, and on x-ray, same thing. He told me absolutely he's ready, but the dog still runs and plays and pivots while running through the backyard, so he told me that he would let me know when when it was time, and I have absolutely no clue. Every time the dog limps a little bit, I'm thinking, is this him letting me know? So I don't really know what to look for, I guess.
So some of my first thoughts when she told me that is that I've seen some Belgian Malinois, Dutch Shepherds, German Shepherds that have some really high levels of pain tolerance. that run through pain. I've seen dogs I remember a dog that we had in Orange. He actually fell. He jumped over a balcony in a church, landed on a pew, broke his sternum, displaced his heart, but we didn't know this. He continued searching, found the bad guy in the bite suit and bit him, and then we put him in the police car. So I know dogs have the ability just to kind of overcome the pain and continue working. Is that good advice to say the dog will tell you?
I'd say yes. If the surgeon talked to you about doing a total hip replacement, it's a major surgery, and in fact, I have a personal experience with it because I have a dog who has hip dysplasia, although she's about 10 years old, and the tough thing with those surgeries, typically they have to have you cage rest them or cage confine them for about 6 months. It's a long time.
Well, I was told 6 weeks.
6 weeks, okay. I mean, yeah, it probably depends on the surgeon, but for my dog, maybe it wasn't 6 months, maybe it was several months, but it was much longer than I would be able to confine the dog. The other thing is there's always potential for other problems that can occur with that. And the other option for that type of surgery is to do a femoral head osteectomy where they cut the head of the femur off. But I guess probably maybe what they mentioned is just you wait and see how he does, and if he's showing the point that he's having so much trouble getting around, you're having to keep him on medication all the time so he can get around, then that would probably be the time that you'd want to look into doing surgery.
Am I going to miss any sort of window by waiting?
No.
Like if he gets too old and starts having other problems that he might not heal quite as quickly from a surgery or heal at all from the surgery?
Well, I'd say in most cases no, because since they're going to replace the socket and replace the head of the femur, that they're not going to have to save any of that part of it. So if it gets worse, it's really not going to make that much more difference. But if you were to wait, let's say, and he waited and he did fairly well until he was 10, 11, 12 years of age. And now if they talk about doing a total hip replacement, now he's not as active. He sleeps most of the day. Is it worth putting him through such a big surgery and having to confine him in a pen for 6 weeks or so? Is it worthwhile? So then maybe at that time you might say, well, maybe at this point now it's not worth it.
Okay.
Where when he's younger and he's more active, you might want to entertain that idea. But it's still a major surgery. And when I see him walking now, I wouldn't think he would necessarily have to have that. It's certainly an opinion that's up to you and the surgeon, but when I see him walking around here, he's doing extremely well compared to what his x-rays look like.
What about pain medication? Is there something that's, if we're giving a dog pain medication, maybe the dog won't be able to tell us that he's in pain if we're using pain medication? How do you feel that works into a dog with this type of situation?
Pain medication obviously reduces their pain, especially if you're using an NSAID, a non-steroidal anti-inflammatory drug like Rimadyl or Medicam. Those will reduce inflammation and also reduce pain. In reducing inflammation is kind of the early, is what leads into chronic calcium deposits in the joint. So if we keep that inflammation under control, that helps to reduce the secondary changes, the calcification of the joint. So in that way it helps. The pain relief effect will help them get around and move better, so it does mask some of what they're showing. And then there's also the potential for side effects if you give him NSAIDs every day for him for the next 10 years. So I think doing it the way you're doing it now, where you're using them on an as-needed basis, is really the best way of doing it. Wants to get out of the way.
Sees those M&Ms over there.
So I think how you're treating them now is very good, and kind of use them on as-needed basis. You're using glucosamines where some people feel that can help improve joint fluid and reduce some of the wear and tear and help to build the cartilage back up in the joints, kind of make up for some of that.
Just you brought up the glucosamine chondroitin issue. Just real quick, I was told way in the past that if you give it to a dog too soon, then the body itself will stop producing those lubricants for the dog. Is there any truth to that, or do you know anything about whether you should do that with a dog that's healthy or not?
I've not heard that. And in fact, they make foods with those products in them already, so I don't think that's a big issue now.
All right. Julie, you have any more questions for the doc?
Nope.
Steve, any more input on what we saw here or anything that we missed?
No, I think that the other option, which we didn't talk about as much as the femoral head, the total hip replacement is the femoral head osteectomy, which you cut the head of the femur off, and if you think, gosh, you're going to cut the ball off, and now there's no ball, you just have the socket and then this bone, dogs will produce a false joint. And in doing that, they kind of scar in and produce this pocket that the bone articulates in. And because dogs will bear most of their weight on their front legs, and they're really using their back legs to hold their rear end up and kind of help with motion, that is a very effective surgery for dogs, especially as they're getting older. And if you especially just do it on one side, it can relieve them of pain, keep them mobile, and not have the potential for side effects with some of the other surgeries.
I was actually told initially that surgery is for a dog of a much smaller weight. Would that be a potential for someone of his 80 pounds?
Yes, you could do it in 80 pounds. And certainly when people start saying, well, should you do it on both sides if dogs have hip dysplasia on both sides, I think that makes just it would be harder for a larger dog to do it on both sides. If you do it on one side, especially the worst side, they're going to that area gets pretty tough, and they walk very well with it. They may shuffle a little bit more weight over on the leg that has a solid bone to joint, but I don't really see that much of a problem with it. And I might reconsider that if we were dealing with a big Rottweiler or some very, very large dog. But you see dogs that have had fractures, and I guess the percentage of dogs that have had total hip replacements versus the percentage of dogs that have had femoral head osteectomies is very low for that type of replacement surgery. So these dogs will usually, historically, have gotten along very well.
Outstanding. I know you're very busy, you got to go, but I just have one real quick question about exercise with a dog that you know has a hip problem. Is it encouraged, or do you want to keep a dog, just kind of confined so that they don't cause any more injury to themselves?
I think moderate exercise, just like in a person, if you lay around and don't move, I think your joints and muscles and things, because there's always a little bit of inflammation, those tissues are going to get stiffer and the joint won't move as well. So I think mild to moderate exercise is good. Jogging, running, long distance exercise, probably not good.
How about swimming?
Swimming, again, in moderation, I think is fine. I think it helps loosen up joints and keeps those tissues from getting too stiff. It's just where to overdo it. And I guess you could say if you're overdoing it, they're going to be limping afterwards. If you can do those kind of activities and they're not in a lot of pain afterwards, then you can do it. The other thing that you can do is with using the NSAIDs like that you have. If you know you're going to go to an activity where we're going to be playing hard and swimming hard, start them out the day before and kind of load their body up with those anti-inflammatories. And then when their joints get used a lot, it'll keep that inflammation low, and then hopefully have a lot less pain the next day.
That's what I tend to do, and he tends to limp a lot less after swimming.
All right. Awesome. So now you guys know, again, why we come to Steve for this type of information. I really appreciate it. If you want some very quality assistance with your dog, you want to come to Yorba Regional Animal Hospital. And any of the doctors that are here, not just Steve, but all the doctors are just very high quality. And you won't believe the facility when you get here. All right, guys, again, this is Andy with the Healthy Dog Network. Thank you, Julie and Ari, and we'll see you at the next one. Take care.